Granulomatous disease. It is Today we are studying about granulomatous disease. So it is most commonly we experience during our routine clinical path lab conditions. When we see different slides, we see a granulomatous condition. Most commonly it is seen in, I think everyone knows, it is seen in TB, tuberculosis. We see it is a type of granulomatous inflammation. So first let us study about the here. Today we will be dealing with the definition, etiology, pathogenesis and the different types of granulomas. So these are the topics mainly we will be covering. So what is the definition of a granuloma? It is a form of chronic inflammation with collection of activated macrophage, T cells, and sometimes it is associated with necrosis. So what is we all know that there is inflammation is there, then there is acute inflammation, chronic inflammation. So it is a type of chronic inflammation with collection of activated macrophages, T cells, and it is associated with necrosis. So what is inflammation? It is a response of a vascularized tissue to, when we know that we commonly see inflammation, so it is a response of a vascularized tissue. So if a tissue is vascularized and if there is any infection or if there is any damage to the tissue, it will bring the cells and molecules of the host defense from circulation. So we know, so from the circulation, the cells of host defense are brought to the site where they are needed in order to eliminate the offending agent. This is a Robbins definition. So what is inflammation? It is a response of a vascularized tissue. So the different vascularized tissues are there. These tissues will respond to any infection or any damage by inflammation. So that, I think this will clear your concept. So any vascularized tissue will respond to any infection or damage by inflammation by bringing their molecules of host cell defense from the circulation to the sites where they are needed, and it is in order to eliminate the offending agent. So we have acute inflammation, chronic inflammation. Chronic inflammation means it is I already told that granulomatous inflammation is a type of chronic inflammation. It is a response of prolonged duration in which the inflammation, tissue injury and attempt at repair coexist in varying combinations. So it is a prolonged duration, that is it is existing from weeks or months, and the inflammation, tissue injury and the attempt to repair coexist in varying combination. Okay, so what are the different etiologies? The different etiologies that we see is a persistent infection, hypersensitivity reactions and prolonged exposure to toxic agents. So these are the different etiologies that we see where we see chronic inflammation. So if a patient is having any persistent infections, so and associated with hypersensitivity reactions and prolonged exposure to any toxic agent, it will cause chronic inflammation. So what is the pathogenesis that we see in these granulomatous disease? We can see is a infiltration with mononuclear cells. So what are the different mononuclear cells? Lymphocytes, neutrophils. So the macrophages. So there is, what do we see in chronic inflammation? So I already told it is a chronic inflammation. It is a long prolonged duration process which is happening. It is like the inflammation, tissue injury and repair, it is coexisting in various combinations. So there will be inflammation with different mononuclear cells. They will be trying to tissue injury and they will be trying to repair both. Then there is tissue destruction and there is attempts at healing. So these are the different pathogenesis of inflammation. So what are the cells and mediators of inflammation? So these are the different causes of inflammation. So what are the different mediators of inflammation? Macrophages, lymphocyte, eosinophils, mast cells and neutrophils. So these are the different cells of inflammation. Macrophages will be there, lymphocyte, eosinophil, mast cells and neutrophils. These are different cells and mediators of inflammation. Next, what are the role of macrophages? So the macrophages, they play an important role in it is a dominant cell in chronic inflammation. It is a dominant macrophages have a it act as a dominant cell in chronic inflammation, and it is the circulating cells of this lineage are called as monocytes, and it is called as the resident tissue macrophages. So these macrophages are mostly involved in chronic inflammation, and these circulating cells of this lineage are called as monocytes. So macrophages are cells which is involved in chronic inflammation. Out of these macrophages, certain cells will get involved in circulation. These are called as monocytes, and the rest are called as resident tissue macrophages. So two types of macrophages will be there. So this is a very basic thing. So there are two pathways of the macrophages. So the macrophages will act by the classical activated macrophage pathway, and then there is a alternative or an alternatively activated macrophages. So these are different pathways in which the macrophage is getting activated. So this is a macrophage. So we know macrophages, it can be resident macrophages or it can be circulating macrophages, which is the monocytes. So how is the macrophage getting activated? So we know chronic inflammation, it is associated with persistent infection. So when there is a persistent infection, mostly it is caused by the microbes or associated with the release of interferon gamma. This microbes or the interferon gamma will activate the macrophages. So there is a classically activated macrophages. This classically activated macrophages are getting stimulated and it causes the release of reactive oxygen species, nitric oxide and lysosomal enzymes. So this reactive oxygen species, nitric oxide and the lysosomal enzymes, it will cause microbicidal action. It causes microbicidal action, it causes phagocytosis, and then it causes killing of many bacteria and fungi. So the macrophages are activated, it is releasing reactive oxygen species, nitric monoxide and lysosomal enzymes. So reactive oxygen species, nitric monoxide and lysosomal enzymes, and it is causing this causes, when the macrophages are activated, it will cause microbicidal action by phagocytosis, and the bacteria, fungi, everything is killed. So the macrophage act as it helps in microbicidal actions. Next we have interleukin 1, interleukin 2. So when the macrophages are activated, it will release reactive oxygen species, nitric monoxide, lysosomal enzyme, and causes microbicidal action. Then there is a release of interleukin 1, 12 and interleukin 23 and chemokines, and these interleukins are released and it causes inflammation. Okay, so this will cause inflammation. Next we have is the alternate pathway. So when is the alternate pathway activated? So when these interleukins are released, it will cause inflammation. So we told inflammation, and then when the certain chemokine interleukins such as interleukin 13 and interleukin 4, it will inhibit the classical activated pathway of the macrophages. So classical activated pathway of the macrophages will cause microbicidal action and phagocytosis. Then it will cause inflammation by interleukin 1, 12, 23. So how to remember interleukin 1, 12 and interleukin 23, and then we have chemokines. So these causes inflammation. Next we have is the alternate activated macrophage. So the alternate activated macrophage will cause growth factors TGF beta. So when the microbe is there or interferon gamma is present, it will stimulate the classical activated pathway. But when interleukin 13 and interleukin 4, this will stimulate the alternate activated pathway. So this alternate activated pathway is stimulated and it will cause the release of growth factors and TGF beta, and it causes tissue repair and tissue fibrosis, and it causes the anti-inflammatory effect by interleukin 10 and TGF beta. So the TGF beta and interleukin 10, it causes anti-inflammatory effect, and the growth factor and TGF beta causes tissue repair and fibrosis. So these are the role of macrophages in chronic inflammation. Next, about the role of lymphocytes in chronic inflammation. So the lymphocytes will amplify and it will propagate in severe and persistent chronic inflammation. So it will amplify and propagate in severe and persistent chronic inflammation. So what happens is how does the lymphocytes will amplify and propagate in a chronic inflammation. So this is a T lymphocyte. So this T lymphocyte will become presence of an antigen to the T cell. So when there is a presence of antigen to the T cells, so the macrophage we know it is getting stimulated by interferon gamma. It is releasing into the macrophage, and the macrophage will undergo classical macrophage activation pathway. Also by presence of a microbe, the macrophage will get stimulated by, and also by interferon gamma. This interferon gamma is released by T helper 1 cells and T helper 17 cells. So we know is that the T lymphocyte and the macrophages. So how are they acting? So when a T lymphocyte, when there is presence of an antigen, the T lymphocyte is getting stimulated, and this T lymphocyte will activate the activated T lymphocytes, such as T helper 1 and T helper 17 is stimulated, and it will form the activated T lymphocyte. So this activated T lymphocyte will act, and it will cause leukocyte recruitment, and it will cause inflammation. So by releasing interleukin 17 and TNF factors, and it will also release other inflammatory mediators, and it will release interferon gamma. So when presence of an antigen to the T cells, the T lymphocytes are activated, and it forms the activated T lymphocyte T helper 1 and so activated T lymphocyte is T helper 1 and T lymphocyte 17. So T helper 1 and T lymphocyte 17, it will cause a release of interleukin 17, and it will cause release of interferon gamma, and it will cause stimulation of the macrophages. Thus the classical macrophage activation happens, and thus the macrophages are activated, which causes leukocyte recruitment inflammation. So here the T lymphocyte are activated, and it is causing leukocyte recruitment and inflammation, and the macrophages are activated, which is also causing leukocyte recruitment and inflammation. And this activated macrophage will again release cytokines interleukin 12, 6 and 23. Okay, so how is these are the role of lymphocytes. After the role of lymphocytes, then how is the formation of a granuloma? So the antigen presenting cells, when there is a persistent microbe, it will integrate the persistent microbe, and it will present so first the microbe is getting stimulated, microbe is detected by an antigen presenting cells, which can be a macrophage. So this macrophage, which act as an antigen presenting cells, it will present the antigen to the CD4 T helper cells. So this CD4 T helper cells will release interferon gamma. First it will release interleukin 12, and it will activate the T helper cells, and this activated T helper cells will release, we already told that activated T helper cell is releasing tumor necrosing TNF, and it will also release interferon gamma. So when the antigen presenting cells, it is secreting interleukin 12 is secreted, and it will activate the helper T cells, and the activated T lymphocyte cells into helper T cells, so CD4 helper T cells. So these CD4 helper T cells will release, activated T lymphocyte will release interferon gamma, and it will secrete tumor necrosing factor. It will release interferon gamma and it will secrete tumor necrosing factor. It is releasing interferon gamma and tumor necrosing factor, and interferon gamma and tumor necrosing factor it is releasing, and this will cause the activation of the macrophages. So this activated macrophages or the monocytes, and this monocyte will change into epithelioid cells, which is the epithelioid cells, and this is called as the giant cells, and these are the lymphocytes and these epithelioid macrophages. Thus it forms a granuloma. So what is a granuloma? It is a microscopic aggregation of epithelioid cells surrounded by a collar of lymphocytes. It is an aggregation of epithelioid cells surrounded by, so we can see a microscopic aggregation of epithelioid cells, and these epithelioid cells will be surrounded by a collar of lymphocytes. So what are the different types of granulomas? So when we ask about what is the definition of a granuloma, it is a microscopic, so it is usually seen in the microscope. Only microscopically we can identify a granuloma. So it is a aggregation of epithelioid cells surrounded by a collar of lymphocytes with or without caseating necrosis we can add. Okay, so the types of granulomas we have is a foreign body granulomas, and then we have immune granulomas. So commonly we have foreign body and immune granuloma. So what is an immune granuloma? It is due to persistent T cell mediated immune response. So the pathogenesis that I told, whether T cells are getting stimulated, and it is getting when first the antigen presenting cells is detecting the persistent microbe, and this is stimulating the T cells, and T cells getting converted to activated T cells, which further activates the macrophages, and this is called as a persistent T cell mediated response, which is causing the granulomas. So this is the same pathway, and by activation of classical macrophage activation pathway, the activated macrophages are released by stimulating the T cells, and it is causing leukocyte recruitment and inflammation. So this is the activated T cells is the T helper cell and T helper 17 cells. So what are the different causes of immune granuloma? Most commonly what we see routinely in clinical practice is tuberculosis, leprosy, sarcoidosis, cat scratch disease, and fungal and parasitic infections. So it is tuberculosis, leprosy, sarcoidosis, cat scratch disease, and fungal and parasitic infections. Okay, so again in detail about what are the different types of granulomas in TB. In TB we see a caseating granuloma, where we see a focus of epithelioid cells rimmed by fibroblasts and histiocytes and lymphocytes, and surrounded by Langerhans giant cells, central necrosis with amorphous granular debris, and there is Langerhans giant cells with central necrosis and amorphous granular debris, and there is acid-fast bacilli also is seen. So this is a typical tuberculous granuloma, which is showing a central area of necrosis. So here you can see the central area of necrosis surrounded by multiple Langerhans type of giant cells and the epithelioid cells. So these are the Langerhans type of giant cells. So these are the Langerhans type of giant cells and the epithelioid cells. So here you can see the central caseating necrosis, and this is the Langerhans type of giant cells. See the Langerhans giant cells. So special stain that we use to identify this is the AFB stain. In AFB stain you will see the bacilli. Next in leprosy. So in next class I will be reading about other type of granulomas, immune granulomas and non-immune granulomas, and different other diseases. Okay, thank you.